the launch and the expansion of some new services that we're providing here. Just by a quick way of some background information for you, we represent a company in the United States called Medical Solutions. It is the second largest healthcare staffing firm in America. And our firm, Worldwide Healthstaff Solutions, is a part of the Medical Solutions family of companies. So together, though, our organizations are able to serve healthcare providers in the United States with domestic staffing solutions, and through Worldwide Healthstaff Solutions, we're able to support the urgent need for nurses through international recruiting, which we've been doing now for the past 27 years. So Medical Solutions is positioning itself to be a provider of the broadest possible range of workforce solutions for U.S. healthcare employers who have ongoing workforce challenges. As we look and prepare to launch what is referred to as a virtual patient sitting service, which is one application of the larger concept of virtual health, this will represent a significant expansion for us in terms of the scope of services that we're able to offer. I'll share with you just really briefly sort of the rationale or the philosophy of why virtual sitting and why virtual nursing and why now. I think those are all reasonable questions to ask. So there's certain facts or certain realities that U.S. healthcare providers are confronted with. One is there is a pervasive shortage of healthcare providers in the United States, whether we're talking about physicians, nurses, various allied health professionals, even down to moderately skilled or what we would even call unskilled workers. There's an urgent need for workers. That's a fact. Secondly, the U.S. education system is incapable of producing the number of graduates that would be required to offset the existing demand together with the aging of the workforce, right? The increasing retirements, etc. Because as the population is aging, the workforce is aging as well. And America is now at the front end of the reality of many other developed countries where the birth rate has been depressed for a period of time such that we're now seeing, slowly but surely, we're seeing decreases in college and university enrollment, just driven by the demographics of the country. So one, we have a pervasive shortage. Two, we're not going to educate our way out of this. Thirdly, as much as we would like to recruit more people around the world all the time, the U.S. immigration system limits the number of workers, right, that we can bring to where the work is. So therefore, right, the next sort of logical extension of this line of thinking is, if we're short, we're not educating our way out domestically, we can only bring so many workers to where the work is. So then what work are we doing in America that we can bring to where the workers are? And that is almost the definition of virtual health in the context that we're looking at it here in Manila. So with those opening comments, I'll pause and...
States. There are telehealth and virtual health is a wide variety, right? So there is the virtual sitting, and that does not require a registered nurse. Okay. It does not require an individual who is licensed in the States. It does not require someone who even has a bachelor's degree. Some individuals will do virtual sitting with a bachelor's degree in mental health. They'll be crisis intervention individuals. They'll be nursing assistants, students that just graduated that are looking for roles. And that's really the market that we're targeting as well. So it's individuals that might have been in a healthcare forum in one way or another. And what they'll be doing is really be responsible to watch about 12 to 15 patients at a time on a screen that really helps you make sure they're safe. And sometimes individuals will be placed on or require a sitter because they're confused and trying to crawl out of bed.
Okay.
Sometimes there'll be individuals that might have an eating disorder, and you need to keep them safe to make sure that what they're doing is appropriate. It might be an individual that had a suicide attempt at one point but is doing better and is not a risk to themselves necessarily at this time. You'll watch them to make sure that they are safe for a few days before you can get them placed in another facility.
So their sitter can stand and
Sit, stand, yes.
right? Yes, so that they can keep their focus on the patients. On that, then there'll be very structured workflows with the US-based health system, and we will train the sitters that are here on how to properly care for those patients.
Okay.
We'll also use a train-the-trainer model so that they'll watch the US-based sitter, and then they will simulate that before we ever get to a live patient.
Okay.
I'm not an IT expert, but I do know we have gone to extreme lengths to ensure that the technology infrastructure is
As robust as possible.
is robust, right? Has built-in fail-safes, has built-in redundancy, and we also have the ability to switch back to monitoring in the US should the circumstances require it. So it's a very good question. We acknowledge that sometimes there are challenges even when we're on video calls and
Yes, even in hospitals in the US.
Yes, yes.
It's going to be the virtual sitting services that we've discussed. As we continue to build out our capabilities here, we anticipate expanding the scope of services that we will provide to actually include registered nursing.
Okay.
So there will be, in an appropriate manner, registered nurses with U.S. licenses located here in our facilities at Bridgetowne that will be providing a wide range of various nursing services to help support the nurses, in the facility and at the bedside in the U.S.
Is this the first?
So, as Worldwide Healthstaff Solutions, which is part of Medical Solutions, we've been doing work here for 27 years, primarily in the international recruitment space. So we have a long and deep history and a long and deep appreciation of working with our teams here in the Philippines. The Philippines has many positive attributes that support us continuing to grow our operations here. From the demographic profile of the country is very positive in terms of workforce. The education level is very high. English language is very common throughout the workforce. Plus our 27 years of experience here, it really wasn't a difficult decision for us at all to determine that the Philippines would be the optimum location to launch this service.
Today, we have our first contract, and we'll be targeting 20 in the Philippines, and they already have housed 49, I think is what they have taken care of that patient group. Do you want to take that?
Sure. So, qualifications would be that they have a minimum of 2 years of medical experience. So it could be a nursing student, it could be someone that's a tech, but they have to have 2 years of medical training.
Not enough, but no need for a professional capacity.
No professional capacity is needed. So they will be trained so that they know how to work the technology, how to follow the clinical workflows, and we'll have a manager here that'll make sure that they're following the workflows that are established.
In Philippine pesos, but there is a very different range of what they will receive. So based on the fact that they are caring for individuals in the United States, it is a bumped up rate.
Okay.